As women, it is inherent that we take care of our breast health. I'm with Dr. Laura Thomas of Raleigh Radiology, and it's important that we think about the screening guidelines for mammography. Can you go over some of those things we really should be thinking about?
Well, I like to keep it simple, and what I recommend for most patients is to have a baseline study between age 35 and 40 and then annually thereafter. For a patient who has a high risk, such as a first-degree relative, like a mom, a daughter, or a sister who has a personal history of breast cancer, then I recommend that they get screened at the age of the first-degree relative minus 10 years, and then annually throughout. So keep it simple, every year after 40.
Every year after 40, okay. For a woman who has not had a mammography or mammogram yet, could you just go through the process a little bit?
A patient comes into the room without her shirt on, but she has a cape on, with a technologist who's always experienced, and I would suggest telling that patient this is your first mammogram. Take the edge off. And the technologist will assist the patient in positioning for two views of each breast. One is done from the top and the other is done from the side. It is showing two different ways to look at the breast tissue, so the radiologist likes to get two different views, and then the technologist repeats it for the other side.
And you use this information to look at the breast tissue?
Yes, a radiologist looks at them. We have special post-processing software that alerts us to small calcifications or masses, some of the things that we're looking for. But we evaluate both views. If there are any prior studies, we compare those back a few years, and to make sure there's no subtle change.
Okay. Now let's talk about one of the other tools that you have to use, which is MRI. So talk about when you would use that for a patient.
Really, what we use that for are two different things. One is problem solving, and that's in a patient who has been newly diagnosed with cancer. We use that to stage and look in the breast and the other breast to make sure there's not a second area of cancerous involvement or something that's questionable. We can also look at the chest wall and the lymph nodes under the arm to see if there's any involvement by tumor there. Another use for breast MRI is in patients for high-risk screening, such as those who have BRCA1 or other genetic mutation. Also, it can be used for screening in patients who have very dense breasts or who've had prior radiation as a teenager or young adult from Hodgkin's disease or something like that. Also, it can be used when mammography is inconclusive, such as a patient with a lump and no abnormality was found. So those are a few of the indications. MRI is not the gold standard, though, so it is a more intense test, but it's not for everyone. You can't just say, I want the best, I need an MRI, because it's very sensitive, so it actually has also false positives. You can pick up things that are not really anything to worry about. Some physiologic enhancement from hormones, for example, is one thing. So it's good to consult with a radiologist or your family doctor about what test is right for you.
Thank you so much, Dr. Thomas. For more information about breast health, you can learn more by going to RaleighRad.com.